Hey everyone, welcome back to the channel. Today we're diving into a topic that's both intriguing and important. The most common sex injuries ER doctors see and the riskiest position that causes the most accidents. Now, I know this might not be your typical conversation starter, but trust me, it's crucial to be informed. As healthcare professionals, we've seen it all, and believe me, some things you just can't unsee. So whether you're a seasoned veteran or just starting to explore your sexuality, this video is for you. We'll be breaking down the science behind these injuries, sharing real-life stories from the ER, and giving you practical tips on how to stay safe in the bedroom. Let's get started. Alright guys, let's talk about something no man ever wants to experience, a penile fracture. It's one of those things that sounds like a nightmare, but it's important to know about it. Now, before you panic, let me clarify that it's not actually a bone break because, well, there's no bone there. The term fracture is a bit misleading, but the pain is very real. But trust me, it's just as painful and requires immediate medical attention. Ignoring it can lead to serious complications. Imagine this. You're in the heat of the moment, things are getting a little too adventurous, and suddenly you hear a popping sound followed by excruciating pain. It's a mood killer to say the least. That, my friends, could be the dreaded penile fracture. It's rare, but when it happens, it's unforgettable. It happens when there's a tear in the tunica albuginea, which is the membrane that surrounds the erectile tissue in your penis. This membrane is crucial for maintaining an erection. Think of it like a sausage casing. It's there to keep everything in place. You apply too much pressure and boom, it bursts. The result is immediate and intense pain. Now, you might be thinking, how on earth does that even happen? It seems almost impossible, right? Well, it's usually caused by forceful bending of the erect penis, often during vigorous sexual activity. Certain positions can increase the risk. And let me tell you, the symptoms are hard to miss. The pain is immediate and severe. We're talking severe pain, swelling that can make your member look like an eggplant, bruising, and difficulty urinating. It's not something you can just walk off. If you ever experience any of these, drop everything and get to the ER ASAP. Delaying treatment can make things worse. Time is of the essence when it comes to penile fractures. The quicker you get help, the better your chances of a full recovery. The sooner you're treated, the better the outcome. Surgery is often required to repair the damage. Treatment typically involves surgery to repair the tear and prevent any long-term complications, such as erectile dysfunction or curvature of the penis. Recovery can take time, but with proper care, most men regain full function. Let's move on to another, shall we say, delicate matter, penile rings. Now, for those of you who don't know, a penile ring is a constricting band that's worn around the base of the penis to enhance erections and prolong intercourse. Sounds fun, right? Well, not always. You see, while penile rings can be pleasurable for some, they can also turn into a nightmare if not used correctly. One of the most common issues we see in the ER is when a penile ring gets stuck. This usually happens when the ring is too tight or when it's left on for too long, causing the penis to swell and making it impossible to remove the ring. Imagine the blood rushing to your penis, engorging it, and that ring becoming a vice-like grip. Not a pleasant experience, to say the least. Now, you might be tempted to try and remove it yourself, but please, I beg you, resist the urge. Trying to force the ring off can cause serious damage, including cuts, restricted blood flow, and even permanent injury. The best course of action is to head straight to the ER. We have specialized tools and techniques to safely remove the ring without causing further harm. Ladies, it's your turn now. While men might seem to have the monopoly on cringeworthy sex injuries, let me assure you, women are not immune. One of the most common issues we see in women is vaginal lacerations, which are basically cuts or tears in the vaginal wall. Now, these can range in severity, from minor nicks that heal on their own to deeper tears that require stitches. So, what causes these lacerations? Well, the most common culprit is insufficient lubrication. You see, when there's not enough lubrication down there, friction increases, and that can lead to painful chafing and tearing. Another common cause is the use of sex toys or other objects during intercourse. While these can definitely spice things up in the bedroom, it's crucial to be careful and use them with plenty of lubrication. Now you might be thinking, how do I know if I have a vaginal laceration? Well, the most obvious sign is pain during or after sex. You might also experience bleeding, burning, or itching. If you suspect you have a laceration, it's important to see a doctor to prevent infection and ensure proper healing. Treatment will depend on the severity of the tear, but it can range from simple over-the-counter pain relievers and topical creams to stitches for deeper cuts. It's also important to follow your doctor's advice on aftercare to promote healing and avoid complications. This might include using ice packs to reduce swelling, taking pain relievers, and avoiding sexual activity until fully healed. Remember, taking care of your body is crucial, and being aware of these risks can help you enjoy a healthier, more comfortable sex life. So ladies, stay informed, stay safe, and don't hesitate to seek medical help if you need it. Your health and well-being are worth it. Chapter 4. Foreign Objects and Rectal Injuries, a Doctor's Wildest Tales. Alright folks, we're about to enter the territory of you can't make this stuff up. As ER doctors, we've seen it all, from the mundane to the downright bizarre. And when it comes to sex-related injuries, let's just say our jaws have dropped on more than one occasion. Now, I'm not here to judge anyone's preferences, but I do feel it's my duty to warn you about the dangers of inserting foreign objects into your rectum. And trust me, when I say foreign objects, I mean anything that's not meant to be there. We're talking bottles, vegetables, sex toys that are way too big. You name it, we've probably seen it. The problem with these objects is that they can easily get lodged in the rectum, causing a whole host of problems. For starters, they can cause tears and lacerations, leading to pain, bleeding, and infection. But it gets worse. If the object perforates the rectal wall, it can release bacteria into the abdominal cavity, causing a life-threatening condition called peritonitis. And if that's not enough to make you think twice, consider this. Removing these objects often requires surgery, which can be embarrassing, painful, and have long-term consequences. Chapter 5. The Heart of the Matter, Sex and Cardiac Risks. Let's shift gears for a moment and talk about a topic that's often overlooked when it comes to sex heart health. Now I know what you're thinking, sex is supposed to be good for your heart, right? And you're not entirely wrong. Regular sexual activity can have cardiovascular benefits like lowering blood pressure and reducing stress. But here's the catch. For some people, particularly those with underlying heart conditions, sex can be a risky endeavor. You see, sexual activity, especially vigorous intercourse, can put a significant strain on your heart. It's like a workout, and just like any other form of exercise, it can trigger a heart attack, especially in people who are already at risk. Now, I'm not saying you have to swear off sex if you have heart problems, but it's crucial to talk to your doctor about your individual risk factors and get clearance before engaging in any strenuous activity, including sex. It's also important to be aware of the warning signs of a heart attack, which can include chest pain, shortness of breath, nausea, and pain radiating down the arm. If you experience any of these symptoms during or after sex, call 911 immediately. Chapter 6. Reverse Cowgirl, the riskiest position for men. Alright, let's wrap things up with a topic that's sure to get your attention, the riskiest sex position. Now I know there are a lot of contenders out there, but according to ER doctors, the one that sends the most men to the hospital is reverse cowgirl. Why is that, you ask? Well, it all comes down to physics and anatomy. You see, in this position, the man lies on his back while the woman sits on top, facing his feet. This gives the woman a lot of control over the movement and depth of penetration, which can be great for her, but not so much for him. The problem is that if the woman loses her balance or the man's penis isn't perfectly erect, it can bend at an awkward angle, putting excessive stress on the tunica albuginea, that delicate membrane we talked about earlier. And as we learned, too much pressure on the tunica albuginea can lead to a penile fracture. Now, I'm not here to tell you to avoid this position altogether, but if you're going to try it, it's crucial to communicate with your partner. Make sure you're both comfortable, and be extra cautious to avoid any sudden movements or awkward angles. Communication is key in any intimate situation, but it's especially important here. Make sure to check in with each other frequently. Also, consider starting slow and gradually increasing the intensity. This can help both partners feel more secure and reduce the risk of injury. Remember, the goal is mutual pleasure and safety. So take your time, be mindful, and enjoy the experience without rushing. Thanks for watching. If you found this video informative, don't forget to like, comment, and subscribe. And remember, always prioritize safety and communication in the bedroom. We've covered a lot of ground today, from penile fractures and vaginal lacerations to the dangers of foreign objects and the importance of heart health. Remember, knowledge is power, and being informed about the potential risks associated with sex can help you make smarter, safer choices. See you next time.